Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Lindsay Seefeldt, a doctor of physical therapy who specializes in oncology rehab and lymphatic services. Lindsay is the owner of Uplifted Oncology Rehab in Green Bay, Wisconsin, and she brings a wealth of knowledge and expertise to her practice. She's a PORI-certified comprehensive oncology rehabilitation specialist, meaning she's specially trained to support cancer patients at any stage, whether they're newly diagnosed, going through treatment, or entering post-treatment survivorship. But that's not all. Lindsay is also a certified lymphedema therapist, helping those with lymphatic concerns and lymphedema find relief and regain their strength. We're so excited to have Lindsay on the podcast today to talk about how she's helping people heal and thrive after a cancer diagnosis, as well as what we can do now for cancer prevention. Let's dive in.
Hey, welcome back to the podcast. We're super excited to have Dr. Lindsay here with Uplifted Oncology. This is our second episode, but in our first episode, we talked all about oncology rehab and all the things about that. And if you guys haven't listened to that, we definitely recommend listening in on all the things oncology rehab. In this episode, though, we're going to be talking about bras and breast health. And I know this is something you're super passionate about, Lindsay. So we're excited to dive into this episode. So can you give us let's talk about bras right away. What's the history of bras? Why do we have them? When did they start? Do you have some insight on that?
Well, I know bras have been around even before Christ. I think there's proof that there was some kind of garment to, support or protect the breast tissue. But really bras came popular and really established in the United States kind of in the early 1900s. And, I think we've all seen different waves of fashion with the bras, the corsets, the pointy cups, even the flasher, no bra era, sports bras became very popular and then the underwire, era as well. And now we're transitioning to wireless, which we'll talk more about, but
absolutely.
It's just interesting to see, just fashion wise and how things have changed throughout the years. And, it's obviously the purpose was to, support the breast, but, other reasons too, it's a fashion kind of statement.
Right. Absolutely. And so how much support do we really need? I mean, what are some clear signs that somebody's just not wearing the right kind of bra for them?
Well, the research says that 85% of us are in the wrong fitting bra. So that's 85%. That is from a study. So that's pretty ridiculous that a lot of us are in the wrong fitting bra. And so, ways that you can tell that, okay, maybe my bra is not fitting correctly. Look at the straps. Are the straps really tight? Are they falling off? Am I having some kind of spillage, whether it's in the front, whether it's, the back fat in the back, whether it's really tight, uncomfortable. And I always say the biggest indication is, look at your skin after you wear your bra. Go in front of a mirror. If you see any type of redness, that is indication that that bra is not fitting like it should.
Yeah, absolutely.
How does an ill-fitting bra affect you internally? Why does it matter? We wear a watch on our wrist, or we have a hairband on our wrist and it leaves a little indent. Why is that a big deal long term?
Yeah. So I love talking about this topic because there is a real physiological issue with wearing an ill-fitting bra. And what we're talking about is, our lymphatic system. Our lymphatic system is in charge of, cleaning up all the debris, exchanging healthy to good, nutritions in our body. We have lymphatics in our breast tissue, natural lymphatics. And in our armpit, we have lymph nodes, and that's where a lot of the fluid will drain to. So a majority of our breast will drain to our arm, our underarm. And so even the slightest pressure, it does not have to be much, can really impede the natural flow of the lymphatic fluid out of our breast tissue. And what's important about that is, well, if we have a little bit of pressure, we could have backup of fluid in our breast tissue. And when we have backup of fluid, we're talking like toxicity. We're talking about substances that are not able to get out of that area. So what happens is it builds up and builds up and builds up in our breast tissue. And we'll start seeing, like fullness in the breast. We'll start seeing cyst in the breast. We'll start seeing density kind of build up in the breast tissue. So that is good indication that our breast is not draining.
Can you have backup in your breast and not have any symptoms?
Yes. Yeah, there's people walking around probably that have, I'm sure if anybody has had a mammogram, a majority of us say that, we have density in our breast tissue. So women can be walking around with this and not have any type of symptoms.
That is important to know. Like, this is the baseline of why we're even talking about this, right? Because if you have toxicity sitting in your breasts, does that potentially lead to a higher chance of cancer?
Well, it definitely creates an environment conducive for cancer. So, cancer loves stagnant, not moving, unhealthy, right? And if you're talking stagnicity, like if that lymphatic fluid is stuck and just sitting there, it won't create cancer, but it'll create an environment conducive to developing cancer.
Okay. So getting back to underwire bras and the type of bras that you were saying, underwire kind of makes sense. Like, that's literally a wire. That's something hard that is applying pressure. So that's probably why you don't avoid those, or that's why you recommend avoiding those.
Correct. Yes.
What about sports bras? Because those can be tight.
Yes. And sports bras you have to be careful with too. The purpose of a sports bra is for, sports, like we're getting out, we're running. We just need a little bit of support for our breast tissue as we're running and jumping and doing all those things. But women should not be living in sports bras because there's a lot of extra compression there. And as I had mentioned, even the little bit of compression can create a backup of fluid.
So is the age that really had it right the braless age?
Yes.
Oh,
okay. So then obviously you have some recommendations and we'll talk about that for certain bras that are going to be helpful, obviously, but would it be best to be braless most of the time?
Yes.
That's the idea, is the less pressure, the better.
Well, I think that's how God created us, right? I don't think we were meant to be conformed to the bra. You look at, even women in third world countries, a lot of them don't have bras. And, I've read a lot of research that, those women have never, in those countries, breast cancer is not even a thing because their bodies are naturally able to flush out the toxins that I had mentioned. Our breast tissue is meant to jiggle and wiggle and bounce and do all those things because we have to have that bouncing to move and propel the lymphatic system because our lymphatic system doesn't have like a natural pump. Like our heart pumps our blood. Our lymphatic system doesn't do that. It requires movement and even massage will also help catapult the fluids. So yes, actually braless is ideal.
That makes sense. When you think about when we walk, we're moving our lymph in our calves and our legs, but we don't have muscles in our breasts. No, that won't work.
Yes.
Yeah.
So they need to bounce. They're supposed to bounce.
That can be pretty uncomfortable, but that's good. That's interesting.
So for someone like me who is fairly pancake chested, this sounds like something that's fairly doable. And I'm sure my husband would be on board. But there are women that do have larger breasts. So as much as it would maybe be ideal to not wear a bra at all, let's talk about how how can we find that balance, right?
Yes.
So maybe sleeping at night with no bra.
Yes. Yeah. That's, I'm definitely a bigger breasted woman. So I can't, I'm wearing a bra today. Like I can't be out in public without a bra on, but ideally, research says that, we really should be in a bra less than 12 hours per day. So I feel sleeping in a bra is the riskiest thing you could ever do. You should never, ever, ever, ever sleep in a bra. You have to be able to rest and allow that natural lymphatic system to flow out of your breast tissue while you're sleeping. So no one should, if you're doing any tips from this episode, do not sleep in a bra, period.
Okay. And then during the day, okay, let's go back to sports bras. So if you're going to do a more high impact workout, wear the sports bra,
yes,
but then put it on, take it off kind of as quickly as you can.
Yeah.
Okay.
When you're doing the activity, absolutely. I have sports bras. I work out. So yeah, wear those bras. But then we need to be switching to something a little bit more different, throughout the day.
Okay. And then what do you recommend for everyday use?
Yes. Well, definitely wireless. Like I am anti-wires. So you need to go out and find a good wireless bra. And so it's tricky. I feel like our market is doing a little bit better job. If you go into like basic Kohl's, Target, I feel like they're giving you definitely more options in regards to the wireless. But you really have to try them on. I think you have to see what fits for you, what gives you the best amount of support. So sometimes it's just a matter of just going in and trying, but then, having a professional like maybe measure you too to see what kind of bra that you should be in.
Okay. And then breast exams. I'm assuming that's something that you would recommend on
Yes.
a regular basis. So maybe what would be best is, can you almost like walk us through what a breast exam would look like?
Yeah, I think it's so important to know your own breast tissue, right? I'll be talking a little bit about a self-lymphatic massage. I do those regularly, so I know my own breast tissue. So, I touch my breasts often. And so I think you have to know what normal feels like to you, right? Because as you're feeling things, and if you notice like, oh, there's a little bit of discomfort here, or there's something here that wasn't there before, you would be a little bit more aware. So I think the key is with self breast exams is you have to know your own breast tissue, and you have to feel everywhere, and especially into the armpit. A lot of times, with breast cancer, for example, we will get it into the breast tissue, but sometimes it'll develop in the underarm, and a lot of women don't go up into the underarm when they're doing peeling.
So let's break that down a little bit. You said you do them regularly.
Yes.
How often does that mean?
I do self-lymphatic drainage at least 2 to 3 times a week. So I'm feeling my own breast tissue 2 to 3 times a week.
Okay. Can you like walk us through like almost, okay, if somebody is not driving right now and they're able to kind of hit pause and they're not in a grocery store, this would be really awkward. What would they actually do? What would this look like?
For an exam?
Yeah.
So I would start, usually I kind of take my first, like the middle 3 fingers, and, a lot of times I'm going to do circular type motions. So like I'll start in my underarm and I'll be doing kind of circular motions, and then I will be going around my breast tissue. So, almost like you want to go around the clock. So your nipples, the sun, and then the outside is the rays. So, I'm just doing like little circular motions around my breast tissue and just feeling for any, abnormality.
So you do it 2 to 3 days or 2 to 3 days a week. Do you notice, or is it normal for your breasts to kind of change, or not change, but feel different throughout your monthly cycle?
Oh, yes. I mean, you're definitely going to get, when you have your period, we're retaining more fluids.
Yeah.
So, and our breasts tend to be a little bit more tender too during that time
I feel
of
like
month.
That's for me, for sure.
Really that time of month, you're not going to have probably an accurate feel at that time. So, that's why I said really get into knowing your breast tissue, because I think the more regular you do it, you just know how it should feel.
I do want to take also some time, since we're talking about breast health and cancer prevention and all of this. And I love how you dove into the lymphatic system and like the why behind this, and maybe why breast cancer is so prevalent nowadays is because we have the girls locked up in a jail, right? All the time, sleeping, everything else. But when it comes to prevention, there are different ways of looking to see if you have changes in your breast tissue. There's mammograms, there's thermography, there's breast ultrasound. I've also heard of this new QT scan thing screening. Can you walk us through what are the different types? What are the pros and cons as well?
Yeah. I mean, screening is great. I mean, women need to find something that they're comfortable with and do the research behind it. But, there's basic differences. So, I mean, we've all heard of the traditional mammogram, right? Basically what that is, you're putting your breast in between two plates and they're squeezing and, putting radiation through to obtain a picture to see the tissue itself. So that is one way. Thermography is, I love thermography. That is basically taking a thermal image of your breast tissue. And from the thermal image, it can detect different heat areas. And so not saying like that heat automatically detects like there must be cancer there, but it'll really give a good indication. Is there something, stagnant here? Like, is there lymphatic fluid congestion? Is there something we need to dive in a little bit deeper? And so ultrasound is another form where it's just using like a sound head, and they send beams through the breast tissue, and then it can paint a picture as well. The QT is something I'm not completely familiar with. I know that's new and upcoming, but all of them. So the radiation is really what comes from mammograms, but thermography, ultrasound, there's no radiation whatsoever in the body. And the thermography and the ultrasound, no pain, no pressure.
What do you do for yourself? Oh, and I guess at what age? So what do you do for yourself? But then for those who are listening and thinking, I want to make sure that I'm staying up on this. What age is it appropriate to start having checks?
Yes. I think, especially, I think starting earlier is very important, especially thermography. I personally do thermography because it really does paint the picture of, it gives a good representation of my breast tissue. And I don't like the thought of having radiation and compression on my breast tissue. So I personally use thermography. I am over 40 now, so I've actually experienced a mammogram before. So, this just my personal preference is to do thermography, but I feel women should be doing this kind of like even in their 30s, start painting the picture at a younger age so that, when you go in annually, you can see, are things changing, are things we can improve upon.
And now I'm going to give the disclaimer, check with your doctor before you make any changes to your plan. But is there does thermography, is it as accurate or is it missing anything where you should also be doing mammograms, or can it really give you the full picture?
You have to, a lot of times, couple them. So a lot of times the thermography will paint a general picture, but if there is an area of concern, they do recommend you follow up with your doctor. And then sometimes recommend either doing an ultrasound to kind of top that, to really assess that area that maybe is of concern. So yes, the thermography is not a diagnostic. It's not going to say, yep, there's breast cancer in there, but it'll at least kind of paint the picture like, okay, I feel like where you're at, maybe you need to dive in a little bit further.
So, and just to take this one step further, obviously I have a lot of questions around this, but if there was cancer, a start of cancer in the breast tissue, would it show up for sure? Is it always warmer? Does it always show up on thermography?
Yes.
Okay. That's really interesting.
I love that idea of thermography too, because it shows those hot spots. And so if you're not doing your tissue massage or if it's like a spot where your bra is digging in or something, they can really have a conversation and talk about how you can improve that. Yeah.
I do a lot of breast prevention health. And so, I work closely with thermographers. That's a term. I don't know if that's what she is technically, but just that paints a picture. So we know like, okay, you have some stagnicity here. Like, how can we help clear that area so we can get that area healthier? And we have seen repeat, these individuals going back for repeat, and it's significantly better reduced.
Mm-hmm. And if you're looking for thermography, you're interested in learning more, you can just head to the Motherhood Alliance website, just type in thermography in the search bar, your zip code, and hopefully there will be someone near you that can help out. So something else also is if someone is experiencing symptoms like breast tenderness or swelling, or maybe they even do feel a lump that they're like, I don't know if this is just I have a little bit more dense tissue or if this is something I should be worried about, what should their first steps be?
I honestly think it's the thermography, because like I said, I think that'll help kind of paint a picture of where that individual is at. And, from there, then you can take that information and come to like a provider like myself where we can, okay, we know it's not, cancer is not concerning, but we know we have things we need to work on, and then kind of going from there. So absolutely, if you're having some kind of, all of a sudden abnormal, you feel a lump, you're having more tenderness than normal, you need to get that checked out.
I feel like going to you too, like getting that done. Like if I felt a lump in my breast and I went to get thermography and then went to you, I feel like I could go through that process a little bit more calmer and have more options than if I just went to my doctor and then all of a sudden, boom, you get all this information overload.
Well, and I will say, like I said, I'm over 40, so I've had a mammogram and I've had thermography. And guess what? The mammogram, they just send you a letter in the mail saying it's clear of cancer and you have dense tissue. That's all it tells me. The thermography paints a huge picture. Like I knew specifically with my thermography scan, the inner side of my left breast was like a little bit backed up. So you better believe when I'm doing my self-work, I am working on the inner side of my left breast. And so I've been doing this now. I'm due for another thermography coming up here soon. So I'm anticipating, because I've been doing my work, that area should be significantly better.
And how often do you go?
Once a year, just like a mammogram. Obviously, if there's concerns, they usually will tell you like, okay, I want to see you, in 3 months. I want to see you in 6 months. But if generally things are looking pretty good, it's very similar as a mammogram, like once a year.
Okay.
Well, then circling back to the self-breast lymphatic drainage massage that you've talked about, you do have a free resource on your website. Is that right?
Yes. And so I am so big in this. If you go to my website, so Uplifted Oncology Rehab, I have an education tab on the top. If you click that, it'll take you to a free video. And in that video, I talk step by step on how to perform a self-lymphatic drainage technique on your breast tissue. Every single woman should know how to do this. I do this 2 to 3 times a week myself, and I'm doing exams on myself when I do this. So I really know my breast tissue well.
We'll link directly to that in the show notes, but then you also do have a course.
Yes.
Tell us a little bit about that.
Oh, I put a lot of work into this. So last summer, I really wanted to provide a very holistic type way women can really get after their breast tissue, because it's so much more than, surface. We got to get in deeper, right? So I talk about in my course a lot about lymphatics. I really dive in deeper. I talk about movement, ways to move your body to get your lymphatic system moving. I talk about bras. I talk about gut health. I talk about mental health. I talk about all the different screenings that we had talked about. So I think it's just a great resource for women that are just wanting to know more and really dive in deeper to get those different levels. It really can make a profound impact on your breast health and general health.
Well, and what peace of mind
yes.
is walking forward, especially if you have family history and you're just, it's on your mind a lot. Like, why not be as proactive as you can be?
Yes.
Okay. And then one more thing I do want to mention is that you have a favorite bra brand.
I do.
And people are always like, just tell me the brand. So why don't you tell them which one you use? And then you also you've partnered with them. So you do have a code for them to receive a little bit off. So tell us about that.
Well, as I had mentioned, I'm a little bit chestier woman. I wear a size D cup, and I was so agitated with I need to find a right bra, but there's nothing that's supportive and not cutting in. And so I don't know, it just popped up on my feed one day, and Evelyn and Bobby, it's meant for bigger chested women. And I'm like, you got my attention. And so, I tried their bra and I fell in love with it. It is so comfortable. They have a patent lift. I think they own the lift technique. So it really provides, a nice support for the breast tissue, but it does not cut in. I'm wearing it today. I hardly feel like I have it on, but it's very supportive. So that is hands down. If you're a chestier woman, you need to check out Evelyn and Bobby. That is by far my favorite bra. And I've tried on tons of bras.
Mm-hmm. And we'll link to that in the show notes as well as the code that you have to receive $15 off of a bra
recommendations
purchase.
For smaller chested women?
Well, that's kind of where, getting in and kind of testing different ones out into the stores, it's like kind of like I want to say like a tankini or something that's not so compressive. You just really have to watch that. It's just wider straps, wider side bands, just make it comfortable, and nothing should be cutting in, period.
Yeah. This was such a great episode.
Yeah, that's very interesting.
Every single woman needs to hear this.
Yeah.
Needs to.
Yeah.
So go ahead and share this with your friends, your family, your coworkers. Let's get awkward, because breast health matters. go ahead and share it with every woman you can think of, because just think about how if you could impact their potential future, if there's so many women have breast cancer now. Do you know the stat off the top of your head?
Yes, it's 1 out of 8, I think, or 1 out of 9. I can't think, but it's really high. It's very high.
Yeah. And that's what we're trying to do here at Motherhood Alliance, is just have a wave of prevention. So you guys who are listening, you can definitely be a part of that by sharing this episode with the women that you love. And then we do have 2 more episodes with Lindsay coming up. We're going to be talking more about the lymphatic system, as well as what our poop should be looking like and why gut health matters. So those are going to be some really fascinating episodes, again, for everyone. So stay tuned for those ones. They're coming up next. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.